for all the buttery, leathery and latex sounds. Welcome to my ASMR channel. Right then, how are you doing there? Are you okay? Lovely. I'm going to just manoeuvre you a little bit because I just need you in a slightly better position for me. Are you okay there? Head rested back? Wonderful, wonderful, wonderful. Right, I'm just going to pop on my mask because I am going to need to get quite close up to your face. Alright? So when you last came in, was it my colleague you saw? The other leather nurse they have on? Oh, I see. She's lovely, isn't she? Don't you just find her a most wonderful, wonderful nurse to be around? She is lovely. I know. I often take my lunch breaks with her. And we'll pop out and have a little cup of tea or a little something together. And a lot of people say that the leather sounds of the leather nurse are really helpful when they're trying to relax. It can be quite nerve-wracking coming to see the doctor, can't it? Not this doctor though, not at all. Right, can I just please? Just going to give you a very quick once-over, so you've nothing to worry about. Let's have a little check here. I'm going to be listening to your chest, alright? Alright then, I'm going to get in quite close to you now. Is that alright? Just here, tapping. Alright. I know, the sound of my gloves on the rubber tubing is sometimes a little off-putting. Alright, I'm just going to lean over here. Now, are you okay there? Good. I'll just feel my glove pressing that down, and I'd like you to take deep breaths for me. Big deep breaths. We'll do it together. Ready? Big breath in. Hold it for me. Keep holding. You can breathe that one out. Alright, I'm just going to have a look at the other side, please. Coming in here. Now hold that there. No talking, please. Good job. One more for me. Amazing. I'm just going to pop that in the centre. Can you give me a little cough? Just a little... Yep. And a really deep one, please. Like a real deep, hard, big cough, please. Amazing. Right. Lovely. You pleased to hear? That's lovely and clear. Yes. Nothing to worry about there. It's all nice and clear. Not to worry. Alright. Okay, moving on, I am of course going to give you a little cranial exam across the eyes and the head, okay? So I might want to, do you mind, I'm going to just need to get quite close up to your temples actually. I'm going to pop my fingers here. You're just going to feel them rolling gently around your temples. Side to side. Round and round, and a small amount of pressure. I'm just going to take my fingers, just going to feel a little tight pressure, a little tight squeeze now. Just breathe for me. What does that feel like? Left side. Feels a little bit more like I'm pressing on a pressure point, right? Not a worry. Okay, are you ready? Right, we're just going to get you to follow the light for me, please. Take your time on this, there's no worry. I just want you to gently follow the light across, alright? It's quite bright. Okay, you can just follow my torch. Left, and then to the right. Okay, can you do me a favour? How many fingers am I holding? Okay, I put them back here. How many fingers am I holding? Alright, let's try that again. Left to right, please. That's it, it's going to come down and up and over. Do you see it? Okay. Alright, can you just, I'm going to put the torch on back here. Just tell me when you see a flash. Yep. How many flashes do you see? Okay, lovely. Alright, one more time. I'm going to get you to follow the light, but this time we're going to go up to the left, alright? I'm just coming in nice and closely to you. Are you okay? Alright, just look out for that light. Going up to the left. Do you see it? Follow it all the way up to the left, please. Slowly with your eyes. Keep looking left for me. Keep looking left. If you can keep pinpointing on that light, I'm just going to come in and measure pupils for a second. Yep, that's fine. I'm going to do exactly the same on the other side, please. Follow the light up and all the way up to the right. All the way up to the right. Keep your eye on the light, please. On the light, just going to come in and do a very quick measurement there. Yep. Okay. Alright, okay. Alright, all done there. Now, how does that feel? Good. I'm very pleased about that. I'm just going to warm my gloves up for a moment. I'm just going to check underneath your glands here. Alright? Alright, no problem at all. Do I need to get you to lean back a little? Right. Coming in underneath my gloves now. Check your glands on this side. Lovely job. And your glands on this side. Fantastic. Excellent job. Feels alright. Have you had any trouble sleeping at all? Okay, a little bit of sleep deprivation. That's not going to help matters. And have you had any problems with eating? Digestive issues? No. Any sudden weight loss? Weight gain? Okay. Well, I'm afraid after Christmas everyone gains a little bit of weight. So just the headaches, nothing else worrying you. Alright. Can I please ask you, in the last 6 months, has there been anything that has particularly worried you? Something that could have somehow triggered perhaps a higher level of stress than usual? No. Oh, I see. So not 6 months ago, but about 9 months ago, you lost your father. Okay. And do you feel that you were supported within that time? Okay. Well, there's not a time limit or a journey that's particularly right for anyone, and if you're still struggling with that, that's perfectly okay. Right? Perfectly okay. The trauma of losing a loved one can stay with us for a very long time. I don't want you putting pressure on yourself that you're not where you think you should be at this exact moment in time. Alright? Okay. Now, do you think you need me to put forward that you would need any extra therapies with that, or do you feel that you're coping alright? I think you are too. I think the occasional night's sleep that's interrupted is perfectly normal. Alright, what I would just suggest is you being a bit more mindful, being a little bit kinder to yourself, just taking those moments in the day that perhaps feel a little bit more highly stressed than others, and just sitting back for a minute and taking a breather. There is no shame in just taking 5 to reset ourselves. Okay? Alright. Well, other than that, I'm happy to tell you that there is nothing serious for you to worry about. I don't think we need to send you for any further tests today. Alright. Well, you go home, make yourself a lovely cup of tea, and have a good rest. I'm happy listening, my darlings.